ASH is developing a new set of clinical practice guidelines on the diagnosis and treatment of VTE. In response to long-standing member interest, ASH assembled more than 100 experts to direct the development of these new guidelines. Topics range from thrombophilia and anticoagulation therapy to VTE in the context of pregnancy and also in pediatric populations.
One of the really important questions that the treatment of VTE panel is tackling is how to decide which patients merit long-term anticoagulation versus those who can stop after 3 to 6 months. There's a question about in patients who have a history of clots and are no longer in anticoagulation, should we do something to protect them from getting recurrent VTE when they travel on an airplane or have prolonged travel? Should they wear compression stockings, for example? And so that's one of the questions that the panel is tackling that focuses on prevention of venous thromboembolism in non-surgical patients.
The ASH annual meeting and exposition is where breaking news is announced. Details coming out about 2 exciting new treatments for hemophilia. During a news briefing, results were released on a new drug that does the job of factor VIII in patients with inhibitors in a small study. 95% of the patients experienced no bleeding events that required treatment. The second was gene therapy AAV5 that involved 13 patients with severe hemophilia A. Even the study author was surprised by the dramatic results, which have lasted over a year and a half.
Looking at other gene therapy programs and hemophilia A being more complicated, bigger gene, more difficult technologically to develop a gene therapy approach, we thought that 5% would be absolutely amazing. We hit 5%, we thought, wow, that's fantastic. And then it just kept going up. We really just could not believe what we were seeing. And so to hit normal or near normal levels in these patients is outstanding, truly amazing.
Another press briefing on engineering solutions to treat inherited blood disorders provided details on 4 novel approaches. They include the first drug specifically designed to treat sickle cell in adults that has now been proven safe and effective for use in children.
And what it does is it targets the red blood cells and makes them look like fetal hemoglobin. Right? So and it kind of prevents them, if you have enough of those in there and they can't deoxygenate correctly, it prevents them from sticking together and actually causing that sickle crisis. And this is some of the first data showing that in pediatric patients.